is Mia Chang, and I will be presenting female hormones and menstrual cycle. In the first half of the ovarian cycle, the anterior pituitary gland secretes follicle-stimulating hormones, which causes maturation of the primary ovarian follicle to the mature Graafian follicle, where estrogen is secreted. In the middle of the cycle, estrogen inhibits FSH secretion and stimulates the secretion of the LH hormone and the LTH by the anterior pituitary gland, which causes ovulation. Progesterone inhibits the production of LH and LTH, leading to regression of the corpus luteum. Progesterone is a steroid hormone that is secreted by the corpus luteum. When there is a decrease in estrogen levels, it stimulates FSH secretion, and that is when a new cycle starts. The follicular phase is when the ovary matures, and it ends with ovulation. The rising levels of FSH and LH causes the growth of follicles on the surface of the ovary, which prepares the egg for ovulation. LH and FSH levels increase and stimulate ovulation or release mature oocyte into the fallopian tubes. As the follicles begin to grow, they start releasing estrogens and a low level of progesterone, which maintains the endometrium to ensure pregnancy. After ovulation, the follicle turns into a corpus luteum, which is a mass of cells that form in the ovary and is responsible for the production of the hormone progesterone. Ovulation is the process where a mature egg is released from the ovary, and it may or may not be fertilized by a sperm. The 6 days are most important because the egg can be fertilized for about 12 to 24 hours after it's released. 14 days before the start of the next menstrual period, this is when ovulation occurs. As for the hormonal release during ovulation, the menstrual cycle is controlled by the hypothalamus and sends signals instructing the anterior lobe and pituitary gland to secrete LH and FSH. The uterine cycle contains the hormones estrogen and progesterone levels, which stimulate increased endometrial thickness. Depending on the thickness of the endometrium, it shows whether the patient is of reproductive age or postmenopausal, which is the period of time after a woman has not bled for an entire year. Because of the hormone estrogen, it causes the lining to grow and thicken, preparing the uterus for pregnancy. In the middle of the cycle, an egg is released from one of the ovaries. This process is called ovulation. The connection between the ovarian and uterine cycle is that the hormones within the ovarian cycle changes in the uterine lining. A week into the ovarian cycle, the developing follicle increases its secretion of the estrogen, and the levels begin to rise. The hormone triggers the cells of the uterine lining to become thicker. Before ovulation begins, the level of estrogen in the body at its peak, and the follicle cells remaining in the ovary develop into the corpus luteum and maintain the uterine lining at a peak thickness, which prepares the embryo for implantation. If the egg is not fertilizing by the end of the cycle, the corpus luteum will break down and stop releasing estrogen and progesterone. Without these hormones, the uterine lining also breaks down, which initiates menses, which is normal vaginal bleeding. A common disease in the menstrual cycle is menorrhagia, which is a type of abnormal bleeding in the uterus and is characterized by heavy and prolonged menstrual bleeding. Other types of this condition include these 4. As for symptoms, a few include a period lasting longer than 7 days, bleeding in between menstrual periods, or spotting, or bleeding during pregnancy. Possible causes could be from hormonal imbalance, pelvic inflammatory disease, uterine fibroids, abnormal pregnancy, including a miscarriage, infection, tumors, or polyps in the pelvic cavity, as well as others. Specific treatment plans for menorrhagia will be determined by your doctor based on factors including age and overall health, extent of condition, current symptoms, and tolerance for specific medications. As for treatments available, some include tranquilizers, antidepressants, regular exercise, surgery, and so many others. These are the references I used. Thank you.